Hi, my name is Elijah. I'm one of the PA students working with Miss Page.
Hi.
So what brings you today?
I'm looking to see what my options are for some weight loss.
Okay.
Just losing a couple pounds.
Yeah. Okay, so weight loss is kind of one of those subjects that's a little difficult for some people because there's so many like fads out there or just get quick result kind of things that people kind of get programmed into thinking like that's how weight loss works. And unfortunately, it's just not the case. It takes time to put on weight, and it takes just as much time to lose weight. Fortunately, we've kind of had this kind of enlightenment where we kind of approach it in three ways. The first way is diet. And so you've probably heard of some of these just through friends, whatever, whatnot. But when we talk about diet, we talk about reducing our fatty foods intake. We talk about reducing any kind of meals that are prepared by frying them. And we also want to reduce our sugar intake. So sticking to a diet like the Mediterranean diet, where the fats that are involved are healthy fats like avocados, olive oil, and nuts like almonds, while staying away from fatty meats like red meat and pork, and sticking more towards lean meats like chicken and fish. Are going to be great ways to kind of eliminate all of the things in our diet that contribute to weight loss. The second thing that we're going to do is try to focus on what kind of behaviors you've built around food. It's something where it doesn't get talked about enough in the public space, but a lot of what weight loss is just kind of reprogramming ourselves to avoid the habits that we've built that aren't unhealthy, that contribute to weight loss. So cognitive behavioral therapy is one of the things that we recommend to our patients because it helps them build better food habits. It helps them, yeah, exactly. It helps them avoid the bad food choices that they can make, just the scenarios that they find themselves in where they're using food in ways to cope with things, that there are other opportunities to use different strategies that can replace what food has kind of built into your ways of dealing with stress or dealing with change or whatnot. And then the third thing that we can do is we can start to incorporate some kind of medications. Some of the medications you've probably heard of, like Ozempic, Wegovy is the kind of like weight loss version of that. Those medications are typically reserved for people who have BMIs greater than 30%, or if they have a BMI of 27%, but they also have another condition that weight loss contributes to, like obesity or diabetes. So at this point, I don't think we need to go that route, but there are medications that we can use. One of them is called phentermine, and that is kind of like a stimulant that kind of helps curb our appetite by working kind of on your brain, right? There's some side effects that we want to pay attention to, like if your mood is changing, if you feel like you're becoming foggy, any kind of things where you feel like your mental capacity is changing some. That's one of the things that we would look for and be like, do we need to discontinue this medication? With all that being said, we would kind of take this like three-pronged approach, prescribe you the medication, get you to see a therapist, as well as like try to form a plan, probably with a dietitian, to create a meal plan that can be sustainable, that you can do and stay on it and not have instance of relapsing into unhealthy food choices, and readdress in probably 2 or 3 months to kind of see what weight loss you have achieved. And if we achieve more than 5% weight loss, we're kind of on the right track, and we can readdress what strategies are working and what aren't, and kind of tailor make your care plan going forward.
I like that.
Okay. Any questions that are kind of
That I can think of.
okay? All right. So let's start there, and we'll see you back in, let's say, 6 weeks, and kind of just reassess and see how you're feeling and go from there.
Thank you.
Okay. Nice to meet you.
Nice to meet you.